Good evening, everyone. Welcome to my live. How are you doing? I'm Adeola Adeyemi. I'm the founder of Talk Mental Health. I welcome you this evening, this afternoon, wherever you're joining in from. I greet you all. Thank you for joining. Okay, so as you join, tell me your name and where you're joining from. Okay, I'm just going to ask you to join, ask your questions and pin. Please ask your questions. I'll pin my comment now. Ask your questions, please. Exactly. Dr. Vundi, thank you for joining. Idowu, thank you for joining. Tell me your name and where you're joining from. I welcome you once again to my live. If you don't know me, I'm Adeola Adeyemi. I'm a psychiatrist and the founder of Talk Mental Health. I'm a mental fitness coach as well. So as a psychiatrist, I take care of people with mental health disorders, depression, anxiety, name all mental health disorders basically. And as a mental fitness coach, I teach people skills that help protect their mental well-being. So I teach people skills that keep them mentally healthy, mentally stable. I teach people skills that would help them build mental resilience. And my organization is Talk Mental Health. It is an organization where we create awareness about mental health, demystify, all the myths, about mental health, normalize discussions about mental health, make it easy for people to talk about their mental health struggles. So that's a brief introduction of what I do, basically. So thank you for joining my live. If you're not following me, make sure you follow me at talkmental.health. And I would also like to meet you. So it doesn't be as if I'm the only one talking. Could you please just tell me your name and where you're joining from? Your name and where you're joining from. Okay? So today I'm going to be talking about depression. Depression is not a choice. Depression is not a choice. I decided to choose this topic because I understand that from my conversation with people, I realized that a lot of time, people really don't understand that depression is a mental health disorder. Yes, some people we have the understanding that it is a mental health disorder, right? But for some reasons, we are quick to, some people are quick to judge those who have mental health disorder like depression. We want them to snap out of it. And we also want them to get better. Perhaps we don't have bad intentions. All right. We really don't have bad intentions. And we keep advising them to get out of it, feel better and do a lot of stuff like that. But the truth is that just like we have, physical health issues, like I always say this, we have physical health issues. We also have mental health issues, just like we have, diabetes, we have hypertension. And when someone has got hypertension or diabetes, you don't tell them to get out of it or snap out of it. You do something, get better, we don't give them that kind of encouragement. We don't do that to them. So I just wonder why, when it comes to mental health struggles, we are quick to ask people to get better, like it is their fault, like it is their own choice, like it is their own doing. But I'm here to let us know that depression is not a choice. As a matter of fact, no mental health disorder is a choice. It's nobody's choice. Nobody chooses to have a mental health struggle. So I'm here to clear our doubts. I'm here to clear the misconceptions. I'm here to let us understand that people who have mental health disorders, they have a lot of things they are struggling with. And we need to be more empathetic towards them. We need to show more love and more support for these people and stop, criticizing or discriminating against them. All right. So I just want to start by the way of introduction. Depression. I know we understand what depression. Some of us do understand what it is. From the word, it's a very common mental health disorder, if not the most common mental health disorder. So sometimes we use the word depressed to express how we feel when we are sad. Okay, I'm depressed. I feel sad, I'm depressed. But I just need to clear this, that when you have depression, clinical depression is different from having that feeling of depression or I'm depressed. That's little down moment you have when you're not okay or something has happened to you. does not is not the same as having clinical depression. Okay, so depression is a mood disorder, so it affects your mood, and it is said to be one of the leading cause of disability worldwide. Wow, it is the leading cause of disability worldwide. You know what that means? I mean, just ponder upon what I just said now. So that's why it's important to talk about depression. A lot of people have depression. Some people are not even diagnosed of the depression. They don't even know they have the depression. Perhaps they are, focusing on physical symptoms, thinking they have physical symptoms, or they are, because of the discrimination and the stigma, they are not bold enough to go and ask for help. So they rather stay in their houses or see their physical health doctors for other physical complaints, not owning up to the fact that they have depression. So that's one of the reasons why we need to be more empathetic towards people that have got depression or any other mental health disorder. So like I said, depression is one of the leading cause of disability worldwide. And we need to be more proactive about, protecting our mental well-being. We need to get the help we need early enough before it gets worse. Because, the more you delay in getting the help you need, the worse the outcome would be or might be. Before you get the treatment, it might lead to, from neurotic disorder, which depression is, it might lead to you having some psychotic symptoms, and you have the probability of staying in the hospital for a longer period, being on admission, and having to use medication for a long time. So early diagnosis is very, very important. Early diagnosis, identification of the symptoms early, getting the help you need as early as possible, getting your management, getting the management right, and sticking to the management plan, adhering to your medications, your psychotherapy, and all that is needed for depression. So like I said, depression is not a choice. If you're following me, thank you everyone for joining. I can see Shion, I can see Like Addict, I can see Fatima, I can see Experit 11. Thank you all for joining. If you're just joining, just tell me your name and where you're joining from. I see Balumi, thank you for joining from Oyo State. Okay, let me go back to what I'm saying. Depression is not a choice. It is a mood disorder. It's said to be the most common mental health disorder, and it is characterized by having low moods. I'm sure I must have said this a couple of times that I've come on live. Depression, clinical depression, is when you have persistent sadness or low mood. So there are 3 core symptoms. The first is that you have depressed mood. You have low mood. Then the second is that you've lost interest in things you love to do. And the third one is that you have reduced energy. So when these 3 core symptoms are present, it's either if you have one of that or 2 or the 3. Then some other symptoms that I'm going to mention soon, you are said to have clinical depression. You have to have these symptoms for 2 weeks, at least 2 weeks. So yes, you may have all the symptoms, but if it is not up to 2 weeks, we cannot make a diagnosis of depression. It has to be present for at least 2 weeks before the diagnosis can be made. So the other symptoms that you might experience could be, poor sleep. So you may have problem with your sleep, finding it difficult to initiate sleep. If you're on this live or you're just watching the replay, listen to me clearly, so that whenever you are experiencing such, or you perhaps come across someone that is experiencing such, you know when to get the help. Because the earlier you get the help, the better the prognosis. The earlier you get the help, the better the prognosis. So I've mentioned the 3 core symptoms of depression: low mood, loss of interest, decreased energy. So the other symptoms that you may experience when you have depression could be that you have poor sleep. And let me characterize the sleep for you, because you can have poor sleep and it's not the type of sleep pattern that you find in depression. So what happens is that you find it difficult to initiate sleep. So you cannot initiate sleep. Say for instance, you sleep 9 p.m. every day, but then you notice that you stay in bed, you keep rolling, you're always thinking, and up until 12 midnight you're yet to sleep. Then there's a problem. And if this it's not just a one-off thing, it's something that has been consistent for at least 2 weeks, then you should look into it. So yes, problem initiating sleep, problem maintaining sleep. So you have frequent awakening. So you sleep, perhaps you've been in bed for from 9 to like 12 midnight, and then you wake up, and after 1 hour you cannot go back to sleep. You struggle to go back to sleep. Some people do wake up to to go to the toilet, and that's fine. And when you're back, you're back, you're able to go back to sleep immediately. But for someone who has depression, you cannot go back to sleep immediately. So it's difficult for you to go back to sleep. And another characteristics of the sleep pattern that you have, it's when you find out that you wake up like 2 or 3 hours earlier than you usually do. We call it early awakening. So you wake up 2 hours or 3 hours earlier than you usually do. Then you know that that's more likely to be depression. So coupled with the other symptoms that I've mentioned. So I've just described the sleep pattern in case you have a friend that has been complaining about sleep. And of course, when you have this kind of sleep pattern, there's no way you feel refreshed in the morning. You wake up, you feel tired, exhausted, like you've worked all night. So that's how it feels, like you're exhausted. You don't feel refreshed. You have headaches and all of that. So that's that about the sleep. Another symptoms you might have is poor appetite. Poor appetite, you don't have good appetite for your food, the things you love to eat, you don't like to eat them anymore, and you now notice that you've lost weight, at least 5% of weight loss within 1 month. Then that is significant. I know that we have something called atypical depression. I think I discussed that my last live, maybe like 1 or 2 weeks ago. You can check my IGTV if you want to, catch up on that. So for atypical depression, the opposite is the case. So you have you eat excessively, and also you sleep excessively. But for typical depression, the common one that we know, there's poor appetite and significant weight loss of about 5% within a month. You can also have problem with concentrating. You can't really focus while studying, while doing your business, while going, taking care of your kids. You find that you have poor concentration, and before you know it, your thoughts start changing. You have distorted, thinking pattern, pessimistic thoughts. So there's something we call cognitive triad in, when talking about depression, etiology of depression. So people with depression, they find it difficult. They have this negative view about themselves. So I said triad, that means there are three points, right? So yes, they have negative view about themselves, about the world, their environment, and about their future. So cognitive triad means there's negative view about yourself, negative view about the future, and then the world around you. So yes, if you have that kind of pessimistic thoughts, feeling guilty all the time, and another thing is when it gets severe, you start to have some psychotic symptoms like having suicidal thoughts. You have these feelings of helplessness, hopelessness, worthlessness. My life is not worth living. I don't have to live anymore. There's nothing to live for. And then you start to consider suicide. So that's when it's becoming worse. It's gotten to a very severe point where you start having psychotic symptoms. So that's one of the reasons why I said early identification of these symptoms is very important. You don't have to just ignore your changes in your mood pattern. You have just mood swings and loss of interest, and you think, there's nothing, it's not serious. It's only a matter of time. If you don't take care of yourself or get the help you need early enough, you may get to a point where you start to consider suicide. So it's always good to get the help you need early enough. I'm going to take a pause. I want to know if you're following me. If you're following me, if you can relate with what I'm saying, if this makes sense to you, can you please put it in the comment box? Put in the comment box if you think this makes sense to you. If this is an eye-opening, if you've never heard of anything about this before, put in the comment box. Let me know you're following me. I'm waiting because I'm about to drop some other points. So please put in the comment box. Tell me, yes, I'm following. I'm following. I'm waiting. I can see all of you on this call, and I really appreciate you for joining. But let me know if you are following me. Thank you, Shion. Thank you, that's my friend. Thank you. So yeah, what I'm saying now, I've given you this background for you to understand that that's what depression is all about. But my topic today is that depression is not a choice. It is not a choice because etiology of depression would make you understand that it is not a choice. It is not something that we choose. sometimes people would say that, oh, it's because you are thinking too much, that's why you are depressed. It is not about thinking too much. People that think too much does not necessarily mean that you come down with depression. That you are thinking too much does not mean that you would now come down with, no, because the etiology of depression is multifactorial. Like, there are a lot of factors that come into play before someone can come with depression. Depression is a complex disorder. You can't just tell me because you're moody today then you have depression. No, it's complex. A lot of factors will come into play for you to come down with depression. See all those symptoms I mentioned. It's not easy for someone to just have everything at the same time. No. And when you see people that are depressed, you will know that they are depressed. I've seen, when I was in Nigeria, oh my goodness, where I used to work, that's Federal Neuropsychiatric Hospital, yeah, but you will see depression. And of course, here as well, I have seen a lot of cases of depression, and it's clear. It's not about how you feel. You know, that momentary feeling of, oh, I'm sad today, somebody hurt you. No, that's not depression. Clinical depression, you will see that it's obvious. It will start to affect the person's level of functioning, your ability to function. You can't function well. You can't do some things that you used to do. Yes, I know that we have high functioning depression. I know some people will still continue to push, but it's only a matter of time. They will definitely break down, and it's usually worse in those kind of people. If you have depressive symptoms and you continue to push and walk, and it seems as if everything is fine, yet you're dying inside, it's only a matter of time. The brain, your body will definitely react to all of that. So depression is not a choice. Why do I say so? I'm going to tell you 3 things. The first thing I would like to say is that people with depression are not lazy. People with depression are not lazy. You need to understand that people with depression are not lazy. I get this comment, from people all the time where they think, oh, it's too lazy. Get up and, walk. Why are you lazy? Why are you just like lying down? Why are you being lazy? That's, a very demeaning word. It's very dismissive of their feelings. It's very dismissive of what they are going through. And it shows that you are not empathetic if you say such words. Yes, they may appear lazy, but they are not lazy. Let me tell you why it appears that they are lazy. You know why? The first thing you need to know is that one of the core symptoms of depression is reduced energy. You know what that means? You have reduced energy, meaning that you cannot walk. You might just be slow. You may not be able to do things because you're weak, you're tired. So someone that has heart disease and has maybe heart failure and is unable to, walk for a long time or do some things, gets, reduced, breathless whenever he tries to walk or do something. Would you tell the person to, he's being lazy, you have to walk or something? You won't do that. Just because it's a physical health issue. It's easier for us, to understand, or, with someone that has got some physical health issues like hypertension or heart failure, and the person is breathless, is weak, he cannot walk. But when it comes to depression, why is it that we keep telling people that are depressed that perhaps have reduced energy, which is one of the core symptoms, of depression? We tell them they are lazy. No, they are not lazy. It's the symptom of depression. When you have depression, you may have reduced energy. So you may not have enough energy to do what you want to do, or to carry out your normal daily activities. It gets to a point that the person with depression may not even want to get up from bed and take care of their personal hygiene. You don't want to have a shower. You don't want to brush your teeth. You don't even want to eat. Like I mentioned, loss of appetite. So it's very important for us to know, and sometimes they can get very tearful. Like I said, you are depressed, you're tearful, you're not happy about what's going on with you. And then because of that, when you're tearful, you're crying all the time, you don't have appetite, you're not eating well, definitely you will be exhausted, you'll be tired all the time. Remember, there's sleep problem as well. If you're not sleeping well, most likely you get up, you will not be refreshed, you will be exhausted. So I'm just letting you know things that could appear, things that people with depression might have that may seem as if they are lazy, but they are not. It's just part of the symptoms. They are not lazy. They're just expressing their symptoms. So can we just be kind? Can we just be empathetic towards these people when they have these symptoms? Can we just be patient with them and put ourselves in their shoes whenever they experience this kind of symptoms? Another thing that we people with depression usually have is psychomotor retardation. That's the way of body reacting. They are very slow to talk, slow to respond. You ask them questions, it takes a very long time to process the information. They're very hesitant, and they're slow to talk, slow to walk. It will be as if they're just very sluggish and all that. It is not their fault. It is not the fault of a person that has depression to experience or to express all of these symptoms. It is just because they have depression. Exactly the same way you would have, presented if you perhaps have like a heart disease, or you have diabetes or any other physical health condition. So don't forget what I just said. People with depression are not lazy. Depression is not a choice. My second point today is that people with depression are not wicked. People with depression are not wicked. I can see that some people have just joined. So if you're just joining, I've said some things. I've been on the live for about 20 minutes now. So make sure you catch on, watch the replay so that you can get the full gist of what I'm talking about today. Okay, so people with depression are not wicked. I've seen comments on, blogs where someone has attempted suicide, or someone has taken their life by suicide, someone has died by suicide, and they would start, people will start commenting. Someone that is already dead, you still be complaining or saying, trolling the person, saying demeaning words, saying that the person, oh, this life is too sweet to die. Things that I'm like unimaginable. Do you think the person that is depressed really want to die? They want solution. That's what they want. It's not as if they wanted to die. So they are looking for solution, and they see death as a way of escape. Not that they don't care about people and they want to make people suffer, or put their children in a lot of issues, and that's why they decided to take their own life. No. So it is bad enough that someone has got depression. Let's not make it worse with the kind of comments that we give to them, or with the kind of way we talk to them, or with the kind of looks we give them, the kind of comments we put out on the social media. People with depression are not wicked. Suicide is one of the complications of depression. It is, when they feel pessimistic, when they feel like life is not worth living, there's marked hopelessness, there's no hope in the future appears so gloomy for them, and, they start to feel worthless. I'm not worth, there's nothing good about me. They have this pessimistic thought that is very overwhelming. I pray you don't get depressed if you're on this live. And if you're depressed, help is available for you. Make sure you reach out to me. I can always help you. I can always connect you with, if you want physical, face-to-face consultation or assessment done, I can connect you to someone that can help. And if you also want virtual, because that's what I offer, I can do virtual assessment for you. So I wish you all the best. I wish you well if you have depression and you're on this level, you're watching the replay. But for those of us who don't have depression, you don't want to have depression. You don't want to feel what that person is feeling. I tell you, it's a very bad experience. So perhaps sometimes we just need to put ourselves in other people's shoes and start to, become considerate, be kind towards these people. Okay, so people with depression are not wicked. They just don't want to die. Life is beautiful, isn't it? Nobody wants to die, but they see suicide or death as a way of escape. So there's marked hopelessness. You don't mean of marked hopelessness. Like there's no hope. I pray you don't feel like that kind of feeling. There's no hope. There's nothing good for me. There's nothing good for me. There's no life. Life is not worth living. All right, and then they decide to die. Another reason why they take their own life is when they have psychotic symptoms. Psychotic symptoms like hearing people's voices. We call it hallucination. So they start hallucinating, hearing voices of people they cannot see. So imagine, when you start hearing voices that others cannot see, and the voice is telling you to take your own life. And the voice, is so distressing. The stress is so much, so overwhelming that you cannot but, obey what the voice has told you. But I experienced that. It's really, really bad. And we need to start, thinking about these things and putting ourselves in people's shoes before we make comments. It helps for us to understand better what is going on, and also show our support people that are around us. And also, when you see some of these symptoms, you connect them to the source of help as soon as possible. All right. So like I said, people with depression are not wicked. They are not wicked. They don't want to die. They only see death as a way of escape. If you have any questions, can you please put in the comment box? I'm more than happy to answer all your questions. Any question, please put it. I have one more point to make. People with depression, the third point is people with depression don't choose it. People with depression do not choose it. Like I said, depression is not a choice. It is not their choice. They have not chosen to be depressed. Rather, it is because of the etiological factors they've got. So yes, depression runs in the family. If for those who don't know, we have a genetic components of depression. So if there is a family member that has got depression, there's higher tendency or higher risk of those other family members to have it. Of course, if it's from father to children, from siblings to sibling, it's higher. So the percentage differs depending on how close you are to that family member. But once there's a family history of depression, there's a higher risk of you having the depression. So can you say that it's not a choice? Do you choose your family? When they gave birth to you, did you make a choice that, this is the family that I'm coming into? You don't make that choice. So is it your choice? So if your family member has got depression, is it your fault? Should you be blamed? No. So, but like I said, we have multiple factors coming into play to make up the etiology of depression. So that you have a family member with depression does not necessarily mean that you come down with depression. All right. Okay. So another factor is there are some chemicals in the brain. I always talk about these chemicals. I also often give tips that can help you increase all these chemicals in your brain, because they are good mood stabilizers or mood regulators. They help regulate your mood. So we call them neurotransmitters. They are released in our brain, and they help to regulate our mood, regulate our function, ability to think, a lot of things about our brain, our mental well-being, so to speak. So whenever people that have depression, when they have a dysregulation in all of these neurotransmitters, they can come down with depression. For instance, serotonin, low level of serotonin. Serotonin is a mood stabilizer. So when you have low level of serotonin in your system, then you are more likely to come down with depression. And when you're saying serotonin, is it that somebody that has depression now went to reduce serotonin by themselves? No. It just happens to people. I mean, like I said, it just happens, and it's not a choice, like I'm saying. Okay, so other factors like environmental factors, child abuse, toxic relationships, insecurity issues, some things that have happened in your past that can come together. Some people, loss of mother at a very early age, lack of confiding relationships, a lot of factors. Yes, some people would have all these factors and still not come down. But I've mentioned genetics, I've mentioned chemicals in the brain, I've mentioned these environmental factors. All of these factors come together. Like I said, etiology is multifactorial. So they come together to make, to predispose someone to coming down with depression. So whenever I see a patient with depression or a client with depression, I would definitely tick out all of these factors to be sure that, to be able to get to the root of why the person has come down with depression. All right. So I hope that with these 3 points that I've made, I've been able to convince you and not confuse you that depression is not a choice. The first point I made was that people with depression are not lazy. They are not lazy. It's just, one of the symptoms they have is, reduced energy. And that's why probably they appear or they come across as lazy, but they are not lazy. The second point I made was that people with depression are not wicked. So that they, contemplate suicide or attempt suicide or they die by suicide does not mean that they don't love their family members or they want to just, put people in trouble. No. It's because they have seen death as a way of escape. They want solution, but they cannot even think or figure out that solution. And they think, oh, death is the only way out. And the third point was that people with depression didn't choose it. I've mentioned the etiological factors. It is not their choice in any way. All right, so yes, I can see some questions here, but I'm going to answer. But before I answer your questions, if you're on this live and you're just wondering, how can I now support someone that has depression? Yes, Dr. Adiola, you've been saying a lot of things about people with depression. It is not a choice. I want to change my ways, if I can say that. I want to change my ways. I want to, support people as much as I can. How do I do that? So I'm going to tell you, I think 4 or 5 things that you could do to support, Yes, it doesn't necessarily mean that you have to financially support. Yeah, finance is good, but there are other ways you could support people who have depression or any other mental health disorder. So the first thing you need to do is acknowledge their pain. Just that acknowledgement makes them feel, heard, makes them feel understood. Yes, somebody understands me. Nobody is questioning my symptoms. So you are not dismissive of their feelings. You are validating their feelings. So you acknowledge their pain. Oh, I can see that this must be very painful. This must be very stressful. It seems you have been through a lot of stress lately. I can see that this has been very overwhelming. These are ways by which you can, validate people's feelings. Not telling them, oh, you have started again. Are you the only one? That's not how to, talk to people who have depression or any other mental health disorder. You have to acknowledge their pains. That alone can go a long way to make them feel good about themselves, like someone understands me. So the first, acknowledge their pain, validate their pain, be very careful when you're talking to them, because you can come across to them as you're being very too intrusive, or you're not even understanding. You have to be able to empathize with them as much as possible. Listen. The second point is for you to listen actively. Many a times we want to listen to people just so we can respond to them. Don't be too quick to respond. You don't even need to respond. Don't have it at the back of your mind that you want to answer this person, you want to give a response, or you want to help. Just be calm. I'm just here. I can hear you. You just be, showing up, empathy through the way you gesticulate. You don't have to say anything. Don't interrupt them. Let them talk. Listen to them actively. Be there. Even if you want to ask questions, you can just ask, how do you want me to be of help? How do you want me to be of help? What do you want me to do for you? Don't give them advice. Don't tell them, go and see Dr. Adiola. No. Don't tell them that. Just tell them, what do you want me to be, do for you? You can, there's a way you can phrase it. Phrase this just so that you will be able to connect them to, I'm going to talk about connecting them to a source of help. The second, just listen. Let them know that you understand before you start giving an ad, trying to connect them to the source of it. And even if you want to do that, there's a way to say it. Empathize. The third thing is for you to empathize. As you're trying to listen actively, let it show on your face. Let it show in the way you communicate, in the way you're being patient, not that you are checking time. As you're there, I told you that they are very hesitant. They have psychomotor retardation, and it takes time for them to talk. They're very slow. It's not as if you'll be checking your time that, oh, time is going, I have to go, I have to leave. It shows that you don't worry, you're not really there for them. So be there. Let your mind be present with them. Show empathy, because it can be anyone. Like I always say, mental health disorder is can happen to anyone. There's no one immune to it. So just think about it, that what if it's me? So what would I have, try and put yourself in their shoes and empathize with them. Even if you want to spend 30 minutes with them, let them know that you are there within that 30 minutes. And the fourth point I would like to say, the fourth way by which you can show support is to connect them with a source of help. So connecting them with a source of help, of course, they need to consent to it. But there's a way to go about it. You see the way I arranged it. I didn't say connect as number one. The first thing is to acknowledge their pain, validate their pain. Secondly, you want to listen. The third one is that you show empathy. By doing all these first 3 things, this person would have trusted you that, oh, this person is you love me, you really care about me. So before you now suggest if they want to, if they need help, don't you think you need to see a doctor, or maybe your GP, or just talk to someone, maybe a professional? You can just, after you've established that rapport and you have, built trust in them, you can just chip that in. At that point, you can now recommend, can you see, maybe you see doctor. There's one doctor I know on the social media. She's the founder of Talk Mental Health. She's a psychiatrist. Do you want to talk to her or something? Do you get what I'm saying? If you can understand me, please tell me. Let me know if you're following. Say yes, 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 yes. If you're following me, if this makes sense to you, tell me in the comment box. Say yes, yes, yes. All right. So the fourth way by which you can show support is by connecting them to the source of help, because last they would need help. And by showing that you are there and all, that's not enough. They actually need a professional. They need a doctor to see them. They need assessment done. They need to be managed. And remember, I said that early identification of the symptoms is important. Early identification of the symptoms. We don't want it to get worse. We don't want them to spend 6 months in the hospital trying to treat what they could have treated within a few months, without admission. So put that at the back of your mind, that your aim is to get this person the help they need. But you have to start in a very nice and calm way. Convince them, let them know you love them, let them know you support them. And then you do that. Then the fifth thing is follow up. Yes, this person has declined. After you've suggested, said, no, there's nothing wrong with me. I'm okay, I reject it in Jesus' name. That person has said it, fine. So you have to follow up. You don't give up. Okay, what's my own? You just move on. Follow up. Maybe there's someone you think the person would listen to. Of course, it's not as if you would violate the confidentiality that you guys have between. You must have at least, ask for consent before you go ahead and talk to maybe another significant other, someone that is important to the person, that you think the person will listen. Or you follow up with the person in, him or herself. You ask him, okay, I just thought to check on you again. How are you doing? Do you feel better? Remember what I told you about, that time? Perhaps you need to see a doctor, or, just tell them, can you watch this doctor? So I have this video, I have this clip. Can you just watch it or something? Just so that you're following up with them. You're following up with them. You're checking on them to see if they get the help they need, because you don't want to lose someone. You don't want to lose a friend. If someone has depression, they might have suicidal thoughts, and if care is not taken, they can act on those suicidal thoughts and take their own life. So you don't want that to happen. Check on them. Follow up. So I've made 5 points. I hope that with these 5 points of mine, you are convinced that you can be supportive to anyone that has depression. You can also use the same for any kind of mental health disorder, anxiety or not, but we're talking about depression today. Before I answer your questions, if anyone is on this live, or anyone that is watching the replay and you've got depressive disorder or anxiety disorder or any other mental health disorder, I like to let you know that whatever it is you're going through is not your fault. Don't feel bad about it. It is not about the mistakes you've made in your past, or someone in your family is against you, or whatever reason you think it may be. That's not it. It is just a medical condition that anybody can have. So 25% of people will come down with mental health disorder. It just happens that you have it, and that's okay. It is treatable. You can get help. If you need help, you can reach out to me. I offer assessment. I offer therapy sessions, cognitive behavioral therapy, as a matter of fact. So just reach out. Ask for help. Ask for help. It is not your fault. I just want to assure you. All right. So I just want to ask if there are other questions. Let me see the chats to see. Okay. How can you avoid it, please? Dambu, I think you're asking how we can avoid depression. Can we really avoid depression? There are things we can do to protect our mental well-being so we don't come down with any mental health disorder. So like I always say, there are some healthy habits. I call it mental health check-in. As a matter of fact, I have a resource for you guys. I'm going to put it on the link in my bio, I think tomorrow, hopefully. I'll let you know when I do. If you don't follow me, make sure you follow me so that you can see that. It's a mental health check-in assessment for you. For you to check whether you need some mental health, just to understand your mental health needs per time. So you check on yourself. There are questions that you need to ask yourself and answer honestly, so that if there's need for you to adjust or make some adjustments in the way you do things, so you can improve your mental well-being, you can do that. So I'm going to put that up in my link, and then you can have access to it, so you can assess yourself, check yourself, mental health, and know that you're mentally okay. So back to your question, Dambo, how do you prevent this? By making sure that you take care of yourself, pay attention to how you feel, pay attention to your mood, pay attention to your thoughts, what you think. So do all of these things. I said depression, you have to have all of these symptoms for at least 2 weeks. So even if you have, perhaps you have depressive symptoms, if you can identify the symptoms early enough and get the help you need, you have better prognosis than someone that leaves it and does nothing. So you need to pay attention, like that resource I told you about, that assessment I told you about. You can do that. Check on yourself, check how you're doing, check how your mood is, check if you're sleeping well, if you're eating well, if you're not losing weight. All of these things are things you need to pay attention to. Make sure you prioritize self-care, take care of yourself, make sure you're sleeping well, make sure you're connecting with people, you're not lonely and all of those things. Make sure you're happy. Even if you're not happy, you understand, all of the time, at least most of the time, you're happy, you're doing things that make sense to you, you're finding fulfillment in what you're doing, you're not stressing yourself. These are ways by which you can prioritize your mental well-being. Ensure you are establishing, healthy boundaries. Doing so many, I have, if you go on my IGTV, you see a lot of videos that I put up there. There's one on tools to try. I think I spoke about how you can be your own therapist, things you can do just to make sure that you're mentally, emotionally stable. So Dambo, I hope I've answered your questions. But more importantly, if you notice all of the symptoms I've discussed about, all of these depressive symptoms, get the help you need. Don't wait till it gets worse. Don't wait till it gets to the point where you start having psychotic symptoms before you get help. Once you notice that you're not okay, you feel sad, and it's been ongoing for a very long time, nothing changes your mood, no matter how happy people are around you, you still feel very sad within yourself, then get help. Perhaps it might just be mild depression that you have, and then you get the help. You might just do one or two some psychotherapy sessions, and you will be fine, rather than waiting till it gets worse. Okay, so getting help early enough is also very good. All right. So any other question? Let me check if there are other questions. Absolute sense. Thank you, Cheryl. Okay, so does anyone have questions for me? I'm happy to answer. What's it called? Depression is treatable. Depression can be treated. We use psychotherapy, pharmacotherapy. That's some use of medications. We give medications. For those who don't want medications, we do psychotherapy. This depends on the severity. So like I said, we've got mild, moderate, or severe depressive disorder. So help is available. Let no one tell you that, the medication you're using, once you start it, something like this will happen to you. No. No. You have to, whenever you're given medications to my clients, I always weigh the benefits against the risks. So would I rather allow this person to continue to have depression, psychotic symptoms, suicidal thoughts, than give them medications that will make them better and have good quality of life? So these are the questions that come to my mind. Like, I'd rather you be fine, because I know that depression is one of the leading cause of disability worldwide. And I don't want you to be one of the statistics. I want you to be fine. One of my, my mission, or my desire, my passion is for you to be mentally stable, for you to be mentally whole, for you to develop mental toughness and mental resilience. So that's why I would rather treat you, give you the medication on psychotherapy sessions that you need, than to allow you to continue to have those symptoms that will affect your quality of life. All right, everyone. Do you have questions for me? I can see Maria. Maria, you joined almost towards the end of the live. Thank you for joining. And thank you to everyone who have contributed. I really, really appreciate you. Please, I want you to, after I'm done with this live, I'm going to put it on my IGTV. I'm going to post it on my feed. Kindly go back and comment. Let me know your thoughts. Let me know your takeout. Let me know what what stood out most for you during this live, what you learned from this live. Make sure you do that for me. I need your feedback. I need your feedback, guys. So make sure you do that. And if you're not following me, make sure you follow me immediately. Do not hesitate to reach out to me. And like I said, I offer therapy sessions, assessments, treatment for mental health disorders. I also offer coaching for your mental well-being. You are not mentally ill. You don't have depression or anxiety or any other mental health disorder, but you just want to ensure that you are proactive about your mental health. You want to learn how to be mentally resilient, how to prioritize your mental well-being, skills that would help enhance your mental and emotional well-being. Reach out to me. You know where to see me. You know where to see me. Come to my DM and reach out to me. Thank you everyone for joining. I can see Saint Nigeria just joined, and Doris. I have said a lot of things and I really welcome you. I appreciate you. But unfortunately, this is the end of my live. Please watch the replay. And if you have questions, make sure you ask me your questions. So guys, have a lovely evening. Enjoy yourselves and don't forget to be intentional about your mental health. Bye.